At 3:17 in the morning, I was called into the operating room for a 74-year-old man who had gone to sleep feeling perfectly fine but woke up with intense, crushing chest pressure. What shocked our team wasn't just the heart attack itself, but what his overnight monitor revealed in the hours leading up to it. His breathing pattern, blood pressure, and heart workload had quietly shifted throughout the night. And the common thread was the way his body had been positioned in bed. As a cardiac surgeon, I see this far more often than most people realize. We're trained to think of heart attacks as events that happen during the day, usually triggered by stress, walking, or physical exertion. Yet modern sleep research shows that what happens while you're unconscious can silently strain your heart, compress your lungs, affect oxygen levels, and change how hard your heart must work hour after hour. Your sleeping position directly influences circulation, airway flow, and the way blood returns to the heart. Scientists refer to this as nocturnal cardiovascular load, which simply means the hidden stress your heart carries while you sleep. For some seniors, certain positions can gradually increase that load until the risk rises without any clear warning sign. Over the past decade, researchers have tracked sleep posture alongside oxygen levels, heart rhythm, and blood pressure in thousands of seniors. They consistently found that 5 specific sleeping positions were linked to higher overnight cardiac strain. In this video, we'll reveal 5 sleeping positions ranked from the least to the most dangerous. And make sure you stick around, because the number 2 position doesn't just raise risk. It can completely change how your heart behaves overnight in a way most doctors never even warn seniors about. If you'd like to see the research behind everything I'm about to explain, you'll find all the scientific sources neatly listed in the description below. Before we dive in, here's a quick question for you. Are you watching this in the United States or somewhere else in the world? And what position do you usually fall asleep in? I genuinely read every comment, and I make it a point to personally reply. So don't be shy. I'm right here with you. Now let's begin with sleeping position number 5, a position most people believe is completely harmless, yet it may quietly place pressure on your heart in ways you would never expect. Number 5, sleeping flat on your back without any elevation. When you lie completely flat on your back with no pillow elevation at all, you may be creating what cardiologists describe as a pooling effect in your cardiovascular system that can make your heart work harder throughout the night. Think of it this way. Your heart functions like a pump that must push blood against gravity to reach different parts of your body. During the day, gravity helps blood move downward. But when you lie completely flat, that normal pattern changes. Blood that usually settles lower in the body can shift toward the chest area, increasing pressure inside the chest cavity. Dr. Susan Redline from Harvard Medical School conducted an interesting study involving 3,000 participants, in which researchers monitored heart rhythms during sleep. The study observed that individuals who slept completely flat experienced about 27% more irregular heartbeats, compared with those who slightly elevated their upper body. The reason behind this is relatively simple. When you lie flat, blood volume redistributes from the legs toward the central circulation. This increases the amount of blood returning to the heart with each beat, which can place extra workload on the heart and may trigger rhythm disturbances in some people. This position can be particularly uncomfortable for individuals with certain heart conditions, even mild ones they may not be aware of. The increased fluid returning toward the chest can place more pressure on the lungs and heart, sometimes making breathing feel more difficult and forcing the heart to work against greater resistance. The good news is that adjusting this position is fairly simple. Adding a wedge pillow or raising the head of the bed by about 4 to 6 inches using blocks or bed risers can create a gentle incline. This small angle allows gravity to assist circulation while still keeping the neck comfortable. Research has shown that a slight elevation like this may help reduce nighttime spikes in blood pressure. Even a modest drop, such as around 11 millimeters of mercury in systolic pressure, can be meaningful over the course of many hours of sleep. You will likely know the angle feels right when breathing becomes easier and you do not feel pressure building in your head. Many people also report less snoring and a more refreshed feeling when they wake up after making this adjustment. One advantage of this change is that it works naturally throughout the night without requiring any extra effort once your bed is set up. Many heart specialists suggest starting with roughly a 15-degree incline and adjusting gradually depending on comfort. And if you think that position might already affect your heart, just wait until you hear what happens in sleeping position number 4. Number 4, the starfish position with arms above your head. That seemingly harmless position where you sleep on your back with your arms stretched above your head, almost like you are surrendering to sleep, might actually place pressure on important blood vessels that supply your heart and brain. Researchers at the Cleveland Clinic discovered something concerning when they studied 1,500 patients using advanced imaging technology. Sleeping with your arms raised above shoulder level for long periods can compress the subclavian arteries and veins, reducing blood flow by as much as 40% and creating what specialists refer to as thoracic outlet syndrome during sleep. Here is what is happening inside your body. When you lift your arms overhead, you narrow the space between your collarbone and your first rib, which is the pathway where several major blood vessels travel. This compression does not only affect your arms. It can create a backup effect in your circulatory system that your heart has to work harder to overcome. The concerning part is that many people who sleep in this position wake up with numb or tingling arms and assume it is simply their arm falling asleep. However, that numbness can actually be a signal that blood flow has been restricted for some time. If someone already has underlying cardiovascular problems, that extra strain can sometimes contribute to issues such as irregular heart rhythms or an increased risk of circulation problems. A study published in the Journal of Cardiovascular Medicine followed 800 individuals who regularly slept in the starfish position. The researchers found that they experienced about a 34% higher occurrence of morning cardiac events compared with people who kept their arms resting at their sides. The effect appeared to be more noticeable in people over the age of 50 and those living with diabetes. The compression is not limited to blood vessels. When your arms remain overhead, the vagus nerve can also be stretched. This nerve plays an important role in regulating heart rate and blood pressure. Stretching it for long periods may influence heart rhythm and circulation during certain stages of sleep. To move away from this position, sleep specialists often suggest placing body pillows on both sides of your body. These pillows can gently prevent your arms from drifting upward while you sleep. Another option is the butterfly position, where you rest your hands comfortably on your stomach or chest. This keeps your shoulders relaxed and allows blood vessels to remain more open. The adjustment period usually lasts about 2 weeks. During that time, you might need to reposition your arms when you wake briefly during the night. Most people report that once the habit changes, they sleep more comfortably and wake up without the familiar arm numbness they once thought was normal. Interestingly, many people adopt the starfish position because they feel it helps them breathe more easily. But the potential strain on circulation may not make that trade-off worthwhile, especially when other sleep positions can support breathing without affecting blood flow. And if you think compressed blood vessels sound concerning, the next position actually changes the pressure inside your skull. But before we continue, if you have been enjoying the video so far, hit the like button and do not forget to subscribe and tap the bell icon so you do not miss more videos like this. Number 3. Stomach sleeping with your head turned to one side. Sleeping on your stomach might feel comfortable and secure, almost like you are hugging the entire bed. However, this position can create a combination of stresses on the cardiovascular system that many cardiologists now caution patients about, particularly those who have a history of heart disease or risk factors for stroke. When you sleep face down with your head turned to one side for long periods, your neck remains in a twisted position that affects the cervical arteries, the important blood vessels that deliver oxygen-rich blood to the brain. Research from the University of California, San Francisco observed that this posture can reduce blood flow through these arteries by as much as 50% on the side opposite the direction your head is turned. The mechanics are surprisingly simple. Imagine twisting a garden hose and leaving it that way for several hours. That is similar to the stress placed on the blood vessels in your neck when your head remains rotated all night. While the body does have alternative circulation pathways, relying on them repeatedly can create ongoing strain and may contribute to long-term vascular stress. The challenges are not limited to the neck. When lying on your stomach, the chest cavity is also compressed. This means the heart must pump against the pressure created by body weight with each beat. That pressure inside the chest, known as intrathoracic pressure, can make it more difficult for blood to return from the limbs back to the heart. Dr. James Parrish, director of the Sleep Disorders Center at Mayo Clinic, monitored 2,000 people who regularly slept on their stomachs. Overnight observations showed that stomach sleepers experienced about 15% higher blood pressure during the night compared with those who slept on their sides, with particularly noticeable increases during REM sleep, when blood pressure naturally fluctuates. Breathing restriction is another concern. When you sleep face down, even with your head turned, you may end up breathing in a greater amount of carbon dioxide relative to fresh oxygen. This can slightly increase acidity levels in the blood and cause the heart to work harder to supply oxygen to the body's tissues. This position may be especially risky for individuals who are overweight or who live with sleep apnea. Extra pressure on the chest combined with restricted airflow can contribute to what cardiologists call positional hypoxia, a state where oxygen levels drop and the heart responds by beating faster and working harder. Changing a long-standing stomach sleeping habit usually requires a gradual strategy. Some sleep specialists recommend placing tennis balls or foam rollers beneath the chest area so that stomach sleeping becomes uncomfortable. Another approach is to use a body pillow and hug it from the side, which provides a similar sense of comfort without placing pressure on the chest. Many people transition by using what sleep therapists sometimes call quarter turns. This means beginning the night on the stomach but slightly rotated toward one side, and then slowly increasing that rotation over time until sleeping fully on the side becomes natural. Patience is important because stomach sleeping is often a habit that began in childhood. However, many individuals notice improvements within a few weeks after changing positions, including better morning energy and fewer headaches. Your neck arteries may already appreciate the idea of making this change, but the next position affects something even more critical. Number 2. Sleeping on your right side in the fetal position. This might come as a surprise because side sleeping is usually recommended, but sleeping specifically on your right side while curled tightly in a fetal position can create certain cardiovascular challenges that researchers are only beginning to fully understand. The findings have raised concerns for people who already have risk factors for heart disease. When you curl up on your right side, your heart, which sits slightly toward the left side of your chest, may have to pump blood in a position where gravity can subtly influence circulation through the aorta. Cardiologists at Stanford University observed that this posture may increase the heart's workload by as much as 23% during the night. The fetal position can intensify this effect. When you pull your knees toward your chest, your diaphragm becomes compressed, which reduces what is known as functional residual capacity. This refers to the amount of air that normally remains in your lungs between breaths to keep them partially inflated and ready for oxygen exchange. With less space for the lungs to expand efficiently, the heart may have to work harder to circulate oxygenated blood throughout the body. For individuals who already have cardiovascular conditions, this additional effort can add up over the many hours spent sleeping each night across a lifetime. Another important factor involves the body's largest vein, the inferior vena cava, which runs along the right side of the spine and carries blood from the lower body back to the heart. When you lie on your right side, the weight of surrounding organs can place pressure on this vessel. This may slow the return of blood from the legs and lower body, a situation cardiologists sometimes describe as venous congestion. A long-term study published in the European Heart Journal followed 5,000 participants over a period of 3 years. The research found that people who frequently slept on their right side in a tight fetal position experienced 31% more episodes of nighttime leg swelling and about 28% higher rates of varicose veins compared with those who slept primarily on their left side. The curled posture also affects cardiac output, which is the amount of blood the heart pumps each minute. When the body is tightly curled, blood vessels in the chest and abdomen can become compressed, creating additional resistance that the heart must overcome with every beat. In addition, sleeping on the right side allows the liver, which is the body's largest internal organ, to rest downward against other abdominal structures. This can increase pressure inside the abdominal cavity, pushing the diaphragm slightly upward and reducing lung capacity, while also placing additional pressure on blood vessels in that region. The goal is not to avoid side sleeping completely, but to make small adjustments. One helpful step is placing a pillow between the knees to keep the hips aligned and reduce excessive curling. Another technique is to gently extend the body instead of pulling into a tight fetal position, imagining a straight line running from the top of your head through your spine. Some people also find it useful to alternate between right side and left side sleeping during the night. As you will see with the number 1 position, however, even left side sleeping has some surprising considerations that many people rarely hear about. Another simple trick is placing a small pillow or rolled towel behind your back so you do not roll completely onto your right side while still remaining comfortable in a side sleeping posture. These small adjustments can significantly reduce strain on your cardiovascular system during sleep. Now prepare yourself for the number 1 position. It may be the most surprising of all because it is often recommended as the healthiest. Number 1. Left side sleeping with poor neck alignment. This is the plot twist nobody sees coming. Sleeping on your left side, a position doctors have recommended for years, especially for pregnant women and people with acid reflux, can actually become the most dangerous position when it is combined with poor neck and spine alignment. This creates what some cardiologists now describe as a cardiac compression scenario that may affect millions of people during sleep. The surprising insight came from a large study conducted at Mount Sinai Hospital. Researchers used advanced cardiac MRI imaging on 3,500 participants and observed that when people slept on their left side with their neck bent at an angle greater than 15 degrees, which often happens with standard pillows, the heart could shift slightly within the chest cavity. In this position, it may press toward the left lung and create mechanical stress on the cardiac muscle. The biomechanics behind this are important to understand. The heart is suspended in the chest by major blood vessels and surrounded by a protective sac called the pericardium. However, it is not rigidly fixed in place. When you lie on your left side, gravity naturally pulls the heart slightly downward and toward the left. If the spine and neck are not aligned properly to support this position, The heart may shift enough to press against surrounding structures, creating what is referred to as positional cardiac stress. Research observations have shown that people who regularly sleep on their left side with poor alignment may experience more premature ventricular contractions during sleep monitoring, which are often felt as skipped heartbeats. Over time, repeated mechanical irritation can potentially affect the electrical stability of the heart's conduction system. Poor neck alignment can also influence the nervous system. When the neck is bent sharply while lying on the side, it can create tension along the spine that affects the autonomic nervous system, particularly the sympathetic nerve fibers responsible for regulating heart rate and blood pressure. This may trigger subtle activation of the body's fight-or-flight response during a period that should normally be restful. A study from Johns Hopkins observed that participants who corrected their left side sleeping alignment reduced the occurrence of nighttime cardiac symptoms significantly. The challenge is that many people are unaware their alignment is incorrect because the position feels normal after years of sleeping that way. Symptoms such as morning heart palpitations, mild chest tightness, or shortness of breath are often attributed to stress or aging rather than sleep posture. Another factor involves the vagus nerve, which runs along the side of the neck and helps slow the heart rate during sleep. If the neck bends at an extreme angle, the nerve may become irritated or compressed, interfering with the body's natural ability to reduce heart rate during rest and keeping the cardiovascular system under subtle stress overnight. Additionally, when sleeping on the left side with poor alignment, the stomach, which sits beneath the heart, can sometimes push upward against the diaphragm. This pressure may affect breathing and digestion at the same time, which is why some people wake up with both heartburn and sensations that feel like heart palpitations. Correcting this position usually requires improving the overall sleep setup. A contoured pillow that keeps the neck straight and aligned with the spine can help, particularly one designed for side sleepers or one that allows height adjustment. Placing another pillow between the arms can also prevent the upper shoulder from rolling forward and compressing the chest. Sleep specialists often recommend aiming for what they call neutral spine alignment. If someone looked at you from above while you were lying on your left side, your ear, shoulder, hip, and ankle would ideally form a straight line. This may feel unusual at first because many people have spent years sleeping in misaligned positions. A slightly firmer mattress or a supportive mattress topper can also help prevent the hips from sinking too deeply, which would otherwise pull the spine out of alignment and bend the neck at an unhealthy angle. Most people adjust to the corrected position within 3 to 4 weeks. Monitoring studies have shown that heart rate variability, an important marker of cardiovascular health, can begin improving within about a week after correcting side sleeping alignment. Many people also report that unexplained morning heart flutters disappear once their posture improves. After learning about these 5 potentially risky sleeping positions, you might be wondering whether there is any safe way to sleep at all. The key is understanding that awareness allows you to make better adjustments. The most important takeaway is that sleep posture does not always need to be completely changed. Often it simply requires better support, proper alignment, and attention to your body's individual needs and existing health conditions. These effects build gradually over time. Even small improvements in sleep position can have meaningful benefits for cardiovascular health when repeated over thousands of nights. If this information has helped you see the hidden effects that sleep posture can have on your health, consider subscribing to the channel for more practical health insights that are not always explained in detail during regular doctor visits. Thank you for watching.